As we've said before, it has officially been 1 year since the first coronavirus case was reported in North Carolina. Hard to believe, but 365 days later, we are still in the middle of a pandemic. Joining us to talk about this trying year and the latest developments in this pandemic is Dr. Shelton with Tryon Medical Partners. Thank you so much for joining us, Doctor. First, I want to talk about the aftermath of being cooped up. People have been anxiously awaiting to get out and enjoy things again. We've seen numbers go down since the post-holiday spike. But are you concerned about another spike now that things are opening up and the weather is nice out?
Yeah, I think that's always a concern. You know, there's two ways to look at that. The winter causes us to go indoors and kind of be grouped together in close quarters versus when the weather is nicer, we can get outside and spread out. So, you know, I think that's going to be helpful in terms of treating a lot of the anxiety we've had recently. But we do have to still be careful. Numbers are trending down. We've had several weeks where it continues to fall after the post-holiday spike in mid-January. So we're really on a good trend. So we have to keep that going. And just because vaccines are now starting, you know, that's great, but that's only one tool. So the social distancing and the masking, those have been the mainstays that have worked for this past year. So we've really got to stay focused on still doing those basics to ensure our numbers stay low so that we really can come out of this hopefully pretty soon.
Yeah, and as more people get vaccinated, how close are we to herd immunity?
That's still probably several months away, actually. So hopefully with the third vaccine coming online now, we can, you know, pick up the pace with that. But it's going to take 70 to 80% of the population either having had the coronavirus illness, although that immunity, that protection could be brief, 3 months, maybe a little longer. And then protection with the vaccines hopefully lasts a lot longer, which studies indicate. So it's going to still take us quite some time, which is why we have to stay vigilant with doing the basics that have been working so far.
A lot of people are concerned about the efficacy rate of the Johnson & Johnson vaccine. I'm wondering how you would compare the three vaccines.
Yeah, so, you know, we see all three of them as equal, essentially. So when we look at the endpoints that really matter, so severe disease, preventing hospitalization, and preventing death, all three of the vaccines are fantastic at doing those things, and that's really what's most important. So we have to remember that the Moderna trial and Pfizer trials were done a little bit sooner before the coronavirus variants were at play as much, versus the Johnson & Johnson trial was done more recently where variants were included in those data. So the numbers are not exactly apples to apples. So it's really not fair to compare those efficacy numbers without knowing kind of the whole picture. But again, the most important thing is to focus on the prevention of severe disease, hospitalization, and death. And that's really what's going to be what gets us out of this pandemic.
All right, Dr. Shelton, thank you so much. We really appreciate your time.
Sure.